Bismillahirrahmanirrahim. I welcome you today to the Sajid event titled Surviving Your First On Calls in General Surgery. معاكم محمد عبد الرحمن خليل, ST5 in the West Midlands, with the valuable contributions of Akhwana Ahmed Babikir, ST5 in the East Midlands. We've combined today to help you survive your first few on calls, which would be less painful to you. If it's okay, we'll make a start. If the voice is okay, let us know.
Yeah, next start.
Okay, we can kick start. We've been given the green light. For our first points that we would like to highlight is it's not rocket science that what you're doing as your first on call. It should be easy, straightforward. Just make sure that you make use of all the resources around you. There's seniors, there's nurses, there's other health allied people that can actually make it very, very easy for you. From my point of view, I think the first bit that we need to talk about is, as a registrar, I'd really want my juniors to be calm and collected. That might be very difficult to achieve on your day one. You'll always be nervous, you'll always be panicking, it'll be a different system for you. However, coming across as a calm person who is willing to walk the extra mile always has that positive impression amongst your seniors. Number one, from the day you start, you'll be in charge of the patient's list. Please make sure that this list is always up to date, including the patient's location. Don't imagine that the patients, just because they were there yesterday, they'll always be in the same place. Patients keep on moving every, 5 or 10 minutes. They can move them from different wards, depending on the bed status in the hospital. So please make sure that you do not miss any patients from the list, and you are fully aware that the patients have actually got their accurate locations on the list. For you to be able to do that, you have to be punctual on time. لازم تجي بدري. There's no excuses for a junior doctor to come in late and wait for people and then delay everything. So just make sure that you're punctual, you've updated the list, you know what the patients had, at least in a كلمتين about their diagnosis. Surgery is very simple, very straightforward. كلمتين about their diagnosis, their latest investigations and the latest blood tests. بعد ذاك people will be taking it from there. عادي ممكن الرجسترار بتاعك يكون ما كان قاعد امبارح او كان ما فيش او كان انقور الاسبوع اللي فات يكون ما عارف البيشنتس. You're the backbone, you're the skeleton for this team. لازم تجي انت تكون عارف او انت تكوني عارفة where the patients are, what did they have, what's their latest investigations, is there anything that they need to be highlighted عشان بعد ذاك الواحد to be able to manage. Usually registrars يعني إذا كانوا قاعدين بالفترة اللي فاتت they will know the patients in and out. إذا ما كانوا هم العملية والعملية ذات. لكن كونك انت تكون updating the list on a regular basis just in case الزول اللي جاي يمر معاك ما عارف البيشنتس او ما يعني he's never came across them او كان ما فيش, you will be fully up to speed اول ما انت تديه او انت تديه the basic information عن البيشنت. They will يعني automatically they will be able to follow you along. So know where they are, be punctual, and the only way for you to be able to update the list مع regular basis انك انت بس تجي بدري او تجي انت بدري وتعرف البيشنتس وين موجودين و you know what their current diagnosis is. كلها كلمتين. cholecystitis, they had an ultrasound showed gallstones, CRP بتاعهم كان كده, البيليروبين بتاعهم كان كده, البلان بتاعتهم حتكون كده. Any current issues about their discharges ولا حاجة events, significant events حصلت لهم over the hospital stay. Their blood test as I say يعني لازم تكون up to date. إذا في طريقة تاخد trends of their blood test يكون تمام. يعني their white cell count is going up, is going down, إذا البيليروبين بتاعهم ماشي فوق ولا نازل تحت. يعني this is a valuable information that people need to know about. بعد ذاك this list for us is almost like a gospel. يعني you'll have to almost worship this list. تقدسوا الليست دي زي ما بتقدسوا أي حاجة تانية. It's probably an exaggeration لكن يعني that's how important it is. الليست اللي بتكونوا ماشيين بها دي يعني تكون يعني almost it's a good guideline to how to manage your ward round. But as important as it is, it's very important that you get rid of it as soon as you leave the wards. اليومك انتهى، الليستة دي يعني لو حتشيلها معاك تشيلها you dispose it في in a safe place. So this is my own perspective about the patient list. Ahmed will pass you the mic to Ahmed, who will hopefully يعني add a few bits and things that I've missed. يعني.
I think Muhammad has covered most of the important issues. Consultants عامة they will not have a look on the list at all. I mean they will rely mainly على the rest of the team to guide them around through the patients. لكن at the minute the consultant has the list in their hands and the list is expired, for example, patient has been inpatient for 4 or 5 days and then is still your diagnosis is wrong. For example, patient is post-operatively lab cholia and then you're saying diagnosed cholecystitis, they know إنه F1 is rubbish. أسف على الكلمة لكن فكما قال محمد your list should be up to date. أسوأ حاجة الثانية إنه you don't know what's going on with your patient. It depends where you work. Some places they have very good software in terms of عندهم برامج توريك البيشنت وين location. You go in and automatically update on a regular basis. Some other places you have to put some effort. برضو it's a 5-10 minutes job. Come 10 to 5, 5 to 8 ولا 10 to 8 الصباح. Your list is up to date. It doesn't put much effort فيها. طيب. It will reflect في النهاية at least it reflects what sort of person you are. If your list is not up to date, you come late, it's a bad impression. People will crack on without you. I mean, our job, يعني محمد قال, Muhammad he knows the patient from the day before, طيب, he will crack on, لكن it will have a bad impression about you as a junior. It's a matter of 5-10 minutes a day, either before you start. Some people they update their list the night before they leave. اليوم قباله they update their list. Fair enough. You come الصباح, all your diagnosis is up to date, your bloods are up to date. You get about the location, about the patient, and print it out. فدي الحاجة اللي أفتكر محمد بسمشن he's already mentioned. الحاجة برضو عايز I have to mention الحاجة الثانية برضو مهمة. أنا ما أعرف إنها some people they may not have been in the kind of أحد ال points between me and محمد يعني. It depends where you are coming from. Are you, for example, been working in the NHS before, or are you still new to the region or to the whole system, the UK itself? واحد كان شغال either في السودان, جاي his first job هنا في البلدية, ولا already he's been through the system. في حبة اختلافات بسيطة جدا between في النهاية البيشنت حتى اللي كنت في مستشفى الخرطوم between العنبر الفلاني والعنبر الفلاني أنت عارف your patients بيسطر الورقة بيسطرها. طيب هنا عندك حبة in the computer. It doesn't matter. لكن at the end of the day you have certain information. Patient's name, their location, and their diagnosis, what bloods, and what's the management plan like. الفرق هنا لسه is a confidential, and there have been lots of issues. Juniors has been into trouble لأنه طلعوا بالليستة من المستشفى. طيب أخذوا معهم البيت ولا في العربية ولا أي حاجة. بالنسبة لهم دي عبارة عن patient information. You shouldn't leave the hospital. تعال آخر اليوم بنت خليها في confidential في أي ملف في المستشفى. Don't risk it. طيب الناس بتنسى. تاخدها في جيبها في الشنطة مع أدراكها. If it has been caught with you, that's a big issue. طيب don't put yourself into معلش sorry for the interruption يعني. I think the list, this is the first point. Wherever you start, make sure that your list is up to date. Next point, Mohammed.
Yeah, so this the summary for this first point in يعني the patient list has to be very up to date. Has to be well documented, well organized. يعني wherever you come from. These are basics. أحمد بيختلف معي إنه في رأيي إنه يعني إذا أنت جاي من السودان ولا جاي من برا السودان قدر الموضوع ده يفرق في your contribution towards your team. أنا في رأيي إنه في النهاية wherever access you come from it doesn't really matter. السيستم في البلد دي almost واحد، البيزك ستراكشر واحد، انت you'll have to walk into it، ما هو اللي بيجي عليك. فيعني as we said the patient list has to be always up to date, well documented, very precise and concise and to the point. وزي ما قلنا زي ما is valuable and quite an important information، هي في نفس الوقت there are confidential. حسب الحته اللي بتشتغل فيها there are different ways where people conceal the confidentiality بتاعت ال patient information، سواء بيحطوا الانيشيالز وبعدك معاه hospital number only ولا كده، المهم يعني whatever way. لكن في النهايه your list that you carry in your hand or you deliver to other people is your responsibility. Please make sure that once you're done with it you actually discard these information، لانه يعني it's a governance issue. هتدخلكم او تدخلك انت برضه في مشاكل كثيره. So I hope we have summarized this first point. The second point I would like to move on is patient documentation in the notes. This remains almost the backbone of what you do on every day. حتجي مارة المرور او حتجي انت مرة في المرور the expectations of the يعني هو طبعا it's a team effort. Even I write in the notes, even my SHOs write in the notes. فيعني انت او انت تكونوا جاهزين to start scribing في النوتس. The documentation هو legally binding contribution بالنسبة للديتا. إذا كان الليلة ده المرور الأول ده this is a major ward round, all you have to do is date it. You don't have to time it if it's the ward round. إذا كان الوورد راوند and في ناس بيختلفوا في الحته دي، لكن according to the GMC guidelines if it's the ward round then you have to just date it, you title it as a ward round وتكتب الاسم بتاع the most senior person or senior people are on the ward round. إذا كانوا consultant تكتب اسم consultant and his level. إذا كانوا registrars you put their surnames and their level. خلاص you don't have to. بشوف انا الاف 1 زي يعني مرات كثيره بيكتب اسامي الناس كلها، معانا سينيور نيرس براكتيشنر ومعانا اف 1 ومعانا ميديكال ستودنت وعباس وعبد الكريم وديل كلهم. You don't have to do that. You have to, because there's only one person or probably maybe two people who will be leading these ward rounds. خلاص. So all you need to do is write the name of the person or the people that are leading this ward round. وخلاص إن هم these are the people that take responsibility. خلاص. On your documentation you'll have to be precise and concise زي كل مرة، و you'll have to be to the point. ما تكتب الكلام الكثير لأنه أصلا يعني you'll be wasting a lot of time. Surgical ward rounds as known as medical ward rounds. إحنا سريعين جدا. We spend maximum maybe 5 or 10 minutes مع كل patient. فأنت what you have to do is the main problem that the patient had, what did the patient actually have as a treatment, the examination finding, and obviously you have to make sure that observation مكتوبة برضو. خلاص. As a registrar there has to be somebody who will deliver to me the facts. لازم أعرف اليوم ده البulse. إذا you spot something that's abnormal tell me. وما بس single one off test. احنا دايرين نشوف الترند برضو. الترند of the blood pressure ماشي فوق ولا نازل تحت. هل البيشنت ده is going into tachycardia ولا is going into bradycardia؟ التمبريتشر بتاعته الترند بتاعه كيف؟ is means والله هستي نورمال لكن امبارح بالليل جاته سبايك بتاع التمبريتشر. I need to know all of that. خلاص؟ فبليز you need to highlight this to your senior. بعد ذاك الاكزامينيشن فايندينجز، الحاجه اللي الناس بتخجل منها تسال الزول الاكزامينيشن فايندينجز بتاعتك كانت شنو on the ward round. This you should never shy of this. انت ما شايف الزول ده هو بيعمل شنو. البيشنت is not grimacing لما عملوا examination للرايبر كوادرنت. يا اخي please ask the person. يعني this people won't tell you off اذا انت سالت الزول what were the examination findings. احنا بنعملها طوالي. انا بسال اذا انا ماشي في الوورد بكتب مع الزول I asked him يعني what was your examination findings. بيكبر يقول لي والله يا اخي انا لقيت في tenderness او في guarding او في rigidity او في كده. فتساله يعني please don't be shy. ويعني be objective. خلاص. subjective matters are not really يعني commendable في الحته دي. just make sure فدي documentation if you're documenting for somebody else you're technically scribing for them. في النهاية once you finished about the examination اكتب تحت إذا he wants to summarize please be clear معه إذا the patient needs to be nailed by mouth. Does he need IVI? What do they need? What's their plan? What's their investigations? إذا عاوزين investigations what type specifically what type. قال لك CT قال لك scan. كثير من المرضى بيقول لك scan. خلاص لكن السكان ده انت you have to make sure ان انت you're clear about what type. Is it a CT scan? Is it an MRI scan? Is it an ultrasound scan? كثير من المرات الناس بتلخبط بين ال CTs وال ultrasounds. Getting the wrong investigation for patients is not going to help them. خلاص بالذات لو قال لك ultrasound انت جيت عملت CT scan يعني you're exposing the patient to unnecessary radiation. You'll be exposing the patient to unnecessary radiation. You write a precise plan according to what they wanted. Is that you're not clear about any point, just stop at that. لأنه تاني ما حد يقدر يرجع للمعلومة دي. خلاص؟ You'll have to make a note of that. وغير كده تخط البلان في your job list. يعني أنت trying to do juggling two things at the same time. You're documenting وفي نفس الوقت you are trying to update البلان بتاعتك في الجوب list بتاعتك. The best way I found out of this is a good memory. تتذكر البيشنتس كانوا وين والبلان بتاعتهم كان شنو في راسك أو في راسك انت. You just need to be able to remember البلانز عشان بعد ذاك يعني when you reconvene مع the rest of the junior team you go through the list and you talk about every single patient and what their plan was. If you are documenting for your own or is this not the major ward round فأنت ما عليك إلا تكتب الدate and you have to time it at this point. And you write your name ولا the name of the person that you're seeing the patient with or you put your documentation. الدوكيومنتيشن بتاعتك يعني إذا أنت نادوك لpatient it depends on what type of the problem is. Soap, I use soap as my guide for my juniors. We'll name soap which is being the subjective, how does the patient feel? Being objective, how do you think the patient looks? Is he comfortable? A is for assessment. So what's his observations? What's his examination findings? Okay. Patient stable, unstable. And P is the plan. For other people who are sick, you'll be using the A, B, C, D approach. Is the airway patent? Is the breathing okay? C is the circulation fine. D is for any disability. Start from neurology. GCS بيتكلم معاك البي ام كان كيف التمبريتشر كانت كيف. بعد ذاك focused examination which is E by exposing the patient, examining their abdomen, looking at the pelvis. إذا عندهم أي مشكلة في lower limbs, إذا في pulses distally ولا ما في. فيعني this is a different way of approaching the patient. يعني it depends on the context. لكن using the SOAP or using the ABCD approach will eventually يعني lead you to the same endpoint. فأحمد لو عندك أي contributions في الحتة بتاع documentation دي you'll be more.
I think في الكلمة في الجال عامة if it's not documented it hasn't happened.
Yeah, definitely.
it doesn't matter في النهاية ward round ولا you have been called at the middle of the night ولا during the day. حتى في discussions قاعد تصل microbiologist. You have done it. A primary ward round, for example, was you have to discuss my microbiologist, or you have to discuss with the radiologist, whatever sort of. You have done it, but you haven't documented. It hasn't happened.
Yeah, definitely.
فالحاجة الثانية المفروض مهمة جدا ما تعتمد على ذاكرتك كثيرا. الحتة ما يبي أو أجلس أدون محمد قال هي بالنسبة للبلان. If you are seeing a post-take ward round 20 plus patients, there'll be lots of jobs to be done. It's a good practice. If you keep a folder, I mean, most of the F1s, most of the juniors, they have their own folders and they keep writing the plans. Otherwise, after the ward round has finished, you come back and go through each of the. Some plans is straightforward. For example, yesterday's bloods. Some other ones they need lots of things to be done. Make sure that all of the plans, either you document them right, من الأول كتبتهم بعد البوست take ward round. أو during your normal ward round. الحاجة الأخيرة في النهاية إن you have to chase them. Yeah. Our plan is take bloods. طيب. If you have requested a blood test or any investigation, it's your responsibility to take them. I personally, I would like a blood or whatever the investigation, if it has been done, our results to be on the notes. Might be يستحق بالك we have mentioned about البلس تكون في list مهمة جدا is okay. لكن I would like it to be the notes better. لسبب واحد. Try to imagine you're on call all night or on call all night. you have been called to see a patient, belongs to a different team, and the patient is becoming septic, for example. Finally, you want to go through the notes. Oh, Mr. Muhammad has been called overnight. He's going through the notes. He don't have access to the list. It's a good idea to have, for example, this patient, he came 2 days ago, عملوا ultrasound scan, it showed he has cholecystitis, and البلس من الصباح مثلا his bloods were abnormal. This is sort of things he will be thinking, لكن a list, he doesn't have access to the list. It doesn't know where you are in the hospital. تمشي تفتح الكمبيوتر تفتش. It's a good practice. You can divide your day. I'm not quite sure where you work ولا انت بتشتغلي وين. لكن ward round في الصباح, investigations. بعد الساعة 12 الظهر, most of the blood results of the investigations will be back. That's when you start chasing them, write them in the notes and the plans. If you are happy making your own plan, fair enough. If you are not happy with doing your own plan, that's the time, hopefully it depends where you work. Your registrar or your seniors will be around in the afternoon. And again, make sure, for example, like documentation. So it's going to be pre and post. What I mean by that, الward round يتعمل الصباح في documentation. آخر اليوم لو في أي change in the plan, طيب, because of an abnormal investigation, it has to be documented. If you have to hand over the patient to the on-call team, طيب, you have to document what you are expecting from them. I would just add one last bit documentation. يوم الجمعة اللي هي خلاص ده weekend يوزع ماشي weekend. It's a good practice to write a weekend plan. And the weekend plan is going to be very brief. So you have someone, he's انت شغال مع colorectal team مثلا. طيب, a patient had an operation, some sort of a bowel resection يوم الثلاث. He's just making slow recovery. You're right, day 4 post whatever investigation, as well as the operation. طيب, investigations throughout. I'll plan for the weekend. So لو البيشنت عنده drain, a consultant عايز drain to be removed on a specific day on Saturday or Sunday, that's going to be the plan. Mobilize. It depends. Different consultants, they have different plans with their patients. Some of them, they take it very quickly. They want the enhanced recovery, eat and drink, mobilize. Some of them take it easy. Regardless, the plan, يفترض تكون on call for the weekend. He doesn't know anything about your patient.
بالضبط أيوة.
And he doesn't have the time to go through all of the things that has happened. It's a good practice. كلها عبارة عن 4 سطور. Diagnosis, operation, here surgeons, فبالتالي لازم يكون في some sort of operation, intervention. The patient, how's he doing, and your plan for the weekend.
Yeah.
Very clear. فده بعتبره مهمة جدا. فدي most my.
Yeah, على النقطة اللي ذكرها أحمد دي is quite an important thing. زي ما يعني in surgery in general, every single patient will be seen over the weekend. Every single patient. فغير ال documentation, the patient list has to be up to date لأنه ال on-call team ما حيكون واحد من your colleagues. حيكون غالبا حيكون من احتمال تكون انت او انت, واحتمال برضو يكون from a completely different team. For these people, you'll have to update them. They have to, you'll usually store the list في حتة معينة. حيكون ال upper GI list somewhere, ال lower GI list somewhere, ال breast team. لكن كل مريض في general surgical wards حيشاف. And it's quite important, people don't spend too much time getting to know them. غالبا registrar or consultant will likely know most of the patients from their own calls, ولا from their colleagues. The sick ones حيكونوا عارفين بهم. Usually consultants get an update from their colleagues about يعني ال patients اللي حصل لهم عمليات يوم الخميس والجمعة, يعني that need like a close eye or close monitoring يعني أو في ال intensive care ولا في كده. لكن أنت أو أنتي المفروض تكونوا عارفين what the patient plans. The easiest way to do that إنك أنت أو أنتي تاخد weekend plan. Very simply, cholecystitis came in on this day, investigations اللي اتعملت كده, البلان. بالذات الوحيدين اللي بيكونوا دايرين يا إما discharges أو محتاجين يكونوا يعني certain investigations تتعمل لهم في الويكند. صعب إن الواحد يمشي له في folder قدر الضربة ويعرف بالضبط البلان شنو just from walking into a patient that's having a snapshot. فدي الحاجة ال quite important. إذا عاوزين البيشنت يمشي في الويكند أو out of hours, please prepare a discharge summary بتاعت البيشنت. ما في حاجة كعبة من إنك أنت تكون أنت on call, they dump on you غير looking after the patients and say the sick ones, يدوك كمان TTOs يقول لك يا أخي عليك الله البيشنت ده ماشي البيت, عليك الله بس اعمل له الديسشارج سمري بتاعته. فبليز بريبير in advance.
في سكشن على discharge summaries ولا
دي كلها تبع
لا it's okay it's the same that's fine.
No, we can talk about it later. المهم غايته definitely يعني في ال weekend plan please be sure انك انت يعني you prepare ال weekend plan for the patients. If they need a TTOs and they're ready to go home, please just don't delay the discharge. Let the TTOs be ready and this is going to be updated by the pharmacist ولا كده. This is a document. I was sorry that we had to talk a lot about it, but like it's quite valuable and quite important. I don't think there's any other points that you need to add.
بس آخر حاجة هقولها بس تريد على الحتة اللي قلتها قبل شوية. Documentation is not only about a clinical documentation. Even discussion with the family. أو ألاقي على أرجع يتكلم مع البيشنت محتاج يتكلم مع الفاميلي حق الطيب. أو أي discussion related to the patient care. البيشنت دخل المستشفى حصل أي حاجة it has to be documented. ما حتعرف أهمية الحاجة دي إلا لما in the future something has gone wrong with the patient and then people start looking through the notes. في normal situations someone come they have their abscess seen by the consultant to theaters discharge straightforward. لكن لما تيجي للحتة حقت إنه في patient تاني is a bit of complicated patient. Unfortunately we are seeing them more and more recently. فأي حاجة discuss مع الفاميلي مع البيشنت ديسكس حصل مع فارماسيست هاي في الموقف الفلاني regarding مع الميكروبيولوجي it has to be documented. your name الستاندرز ما حخش على الحاجات اللي بتصير تكتب شنو لكن بس my point is whatever has been involved in patient care has to be documented. I think that's
ايوه بالضبط خصوصا لو بتتكلموا مع الفاميليز يعني most of the complaints يعني usually the patients that come through are now the geriatric patients اللي هم elderlies. A lot of them are demented ولا عندهم مشاكل كثيرة و they need an operation. Their operations are not straightforward. There'll be big operations. There'll be a lot of discussion مع الفاميلي. إذا أنت أو أنت كنتوا part of that formal discussion the expectation أنتوا حتكونوا you're documenting. Please document who was there. الفاميلي كانت منو بالضبط الأم الأبو الأخو الأخت البنت القريبة the son-in-law the father-in-law whatever. Please document the names and the relationships لأنه ممكن يكون brother-in-law ما كفاية يعني من هم بالضبط. بعد ذلك بيكون في fuse between الفاميلي مرات يقول لك يا أخي والله ليه تكلمت مع ده. please be sure يعني أنت you document the name of the person the senior member of staff اللي كان قاعد معاهم إذا كان في برضه staff nurses برضه present لأنه هم they also could document on the other side. As Ahmed said يعني it's okay when الأمور كلها تمشي تمام لكن once things go wrong it's only your documentation that will get you out of it. But proper documentation is very valuable. We'll probably move to the next point. Yeah. The next point is probably what you will be doing also day in and day out. Just discussing referrals and scans. Unfortunately, الحاجات دي sometimes you'll find that this is probably even more than your level. بس لأنك انت او انتي are the people that are around on the ward سواء انت as a foundation doctor or at a junior SHO level you'll find that your surgical registrars are not around. ما قاعدين بيجوا عملوا معاكم المرور وطفشوا مشوا وين انت ما عارف مشوا الكلينيك مشوا الثياتر they'll be contactable by some means لكن في حاجات بيدوك ليها او بيدوك اليها ويقول لك يا اخي امشي اعمل عليك الحاجات دي. It will likely be واحدة من اثنين discussing scans we're referring to other departments. These will be two things that you will have a hell of work trying to الطريقة اللي انت you can get away with it انك انت just be concise be precise introduce yourself to the person on the other side of the phone well if it's a face to face introduce yourself or be very nice and polite. خلاص once you start from that point people will find you easier to communicate with. Be nice, polite and be precise. والله يا أخي أنا الدكتور فلان الفلاني from the upper GI department I have few things I need to discuss with you. I've been ordered by my registrar or by my consultant to discuss these scans. واحتمال لو it's an urgent scan غالبا هم بيكونوا سبقوك ليها يعني أو بيكونوا سبقوك ليها. لكن يعني sometimes في routine scans that they would like and they're not free to do it. Be precise, be polite and be nice. Introduce yourself يعني be very specific about what you're after. fidgeting around وما عارف والله ما متأكد إذا أنتوا حاسين إنه أنتوا ما بتقدروا تقولوا كلام ده spontaneously it's nice to have a piece of paper اكتبوا كلامكم اللي دايرينه فوق ال piece of paper دي بعدك اقول له يعني من الورقه يعني والله عندي patient XX عنده كده. make sure انك انت اذا you're trying to refer a patient or discuss a patient scan مع زول تانية او زولة تانية, please have the patients all the information in front of you. The worst thing that when you get a referral من patient, يعني احنا we get referrals from other departments. The worst nightmare انه زول او زولة يشيل السماعة ويضرب لك ويتكلم معاك وهو ما عارف البيشنت هو منو او doesn't know the patient in and out. اسهل حاجة تمشي تقفل الزول ده, تقول لي يا اخي الله عليك الله لو ما عارف البيشنت ما تتكلم معك. Don't waste my time. A waste of time is the only thing that people see out of you when you're shaking you don't know your patient. This is the only thing that people see from you. فاذا الناس حست انه انت you're shaky you don't know your patient بيقفلوك يقول لك يا اخي امشي تعال بعدين يعني والله ما فاضي لك. People are very busy. فيعني what they from you انك انت يعني you know your patients in and out and you're precise, you know what you want out of them. سواء ده كان scan ولا referral. Make sure that you're talking to the right person. دي واحد. Make sure انك انت you know what you're after. والله ما متأكد والله ما عارف. Before you go down or before you pick up the phone or before you refer, please make sure انك انت اذا ما متأكد اتأكد من زول تاني. There'll be somebody more senior than you that will be able to help you when you come down to that. The other thing, sorry about that. The other thing is just make sure انك انت زي ما قلنا precise, concise, you know the patient in and out and you are to the point. What are you after? يعني be very polite but the people will respond to that. this is my and يعني بعدك make sure انك you're talking to the right person. يعني اذا مشيت للراديولوجيست وبديت تردح معاه في موضوع هيقول لك والله بالنهايه يا اخي والله معلش لكن انا ما انقل. حتكون انت you wasted about half an hour زحيته منك وانت ذاتك زيدت ده. فميك شور انك انت يعني are you the person on call. اذا ما on call خلاص خديني do you know who is on call او do you know who I should be speaking to. بعد ذاك ابدا مع اول موضوع. احمد لو عندك اي contribution.
كده في امجد عبد الهادي الحاج he asked about is there any consultation paper for another department if a patient is already admitted. It depends where you work. في بعض المستشفيات عندهم paper it depends again برضو على situation. يعني if it's an emergency you are working and you want for example you have someone you think he has an MI for example or any SES. That's going to be direct consultation through the phone. If it's something a bit of more or less an elective or a bit semi-elective, for some departments they have paper-based. Some of them they have online referral system. For some of them even you can just literally ask the GP to refer them for that condition. It differs where you work أمجد.
وفي محمد عباس قال اتكلم عن SBAR system برضه which is another way of يعني of referring patients. We can talk about that. في النهاية لكن it's a way of knowing your patient, talking about the situation وبعد ذاك الحاصل شنو بالضبط. What is the assessment of the patient and what do you want them to do? These are the valuable points. So are you referring a patient to a different department? Well, you are trying to discuss a scan and get the patient a scan, which will be probably the usual thing that you're getting. في النهاية the way you do it is just being systematic and concise. بعد ذاك زي ما قلنا be polite. لما تخلص من consultation be thankful يعني thank you for يعني for accepting this patient or thank you for your contribution يعني. وزي ما أحمد قال لكم أنت قلت يا أحمد.
لا بس كان زي ردا على أمجد.
إذا كان في referral it depends on where you work. أنت you will only إحنا this is a generic video. لكن where you work please just go and find out. في ناس عندهم الأونلاين referrals, في ناس عندهم paper referrals ال on call team. it depends on where you work. لكن في النهاية السيستم حيكون واحد. يثرب فرحات قالت الفيديو عن شنو يثرب ده this is about surviving your first on calls in general surgery. فتكلمنا عن few points. تكلمنا عن ال documentation في النوتس وتكلمنا عن ال patient list. وهسه احنا we're discussing how to refer and how to discuss scans with other departments.
And I would like us to حكاية السكانز دي. فبقول لك there are two people. The more you give them, the more they'll give you. A radiologist or pathologist. Most of the time you'll be on the post-take ward round أو لا في الward round هيقول لك أعمل سكان زي محمد قبل قال. أنت you're not sure يا حياة to scan وليه. فالحاجه الاولى تتذكر او تذكري انتوا دكاتره، طيب انتوا ما بس جايين داخلين عشان تكتبوا. فكومن سنس لو patient جاي ب right upper quadrant pain, differential diagnosis cholecystitis, and they've asked for scan, automatically it's going to be an ultrasound scan. ف make up your mind, I mean that sort of things. لكن برضو لو في حاجه انت are not sure, ask. في لحظه don't be shy. Yeah, to scan ليه؟ لأن at the end of the day you'll be the one who'll be discussing it, and you don't want to be look stupid يعني في النهايه discussing a patient an indication. أسوأ حاجه يقول لك في بعض الحالات even we say it. طيب يقول لك الكونسلتنت عايز. It happens sometimes. طيب لكن most of the time انت ما تقدر الراديولوجيست تقول لك والله my consultant عايز السكان ده. ليه؟ في شنو؟ is better if you ask your consultant طيب ولا الريجسترار مثلا ليه السكان ده؟ You can't في النهايه you can't challenge them في النهايه ما يعرف والله انت are asking for an ultrasound scan, this is a patient with a high BMI مثلا طيب why can't we go for a CT scan? And some people they change. بالعكس كمان I will be impressed في النهايه انه يا اخي والله my junior he's using his brain طيب I like it. ف ask why are we doing this scan.
بالضبط ايوه.
الحاجه الثانيه طيب البيشنت ده ماشي بسي تي سكان is a very basic as well. One of the questions you'll be asked about in CT scan محتاج contrast. Have a look on your patient blood before making that call. لأنه automatically the question okay CT scan accepted. What's your patient renal function like? I haven't checked it. I'll go and check it. You should know your patient.
أيوة بالضبط أيوة. So as Ahmed said يعني there's nothing worse than you trying to refer a patient that you actually don't know very well. لأنه يعني بالذات إذا over the phone I would like all the information. أنا غالبا مثلا أنا ده لو جاني referral من الميديكال ديبارتمنت أنا يعني غالبا يكون أنا I want to answer this before I start to operate. عشان أعرف يعني how quickly do I need to respond to it. فلما أنت تضرب لي أو تضربي لي أنت تقول لي يا أخي والله يا أخي احتمال maybe والله ما متأكد يا أخي أنت ما عارف وأنا ما عارف. That will be the end of that discussion. Full stop. Trying to explain to your seniors why a referral has not been accepted or why a scan has not been done even though they've actually specifically asked for it will be a very difficult job for you.
One last point حكاية referrals للother departments. Most of the time you'll be starting your night shift طيب أو جاي day shift وفي patient should have been referred to a different department. You'll be handed over like a patient محتاج to be referred للميديكس.
أيوة.
okay you'll make refer to the medics هتدفع سماعة تليفون تصل بالميديكال ريجسترار على كلام ليك patient ده he wants we would like medical review ليه؟ I think has some chest pain. فحب أسألك عن patient you haven't seen. My advice to you أي patient need to be referred go and see the patient before you refer them. My own sort of advice. Do not refer second hand. لأن you haven't seen the patient your information is going to be a half cooked. فأتمنى في النهاية إنه أي واحد طلبوا منكم يا جماعة to refer the patient. Sometimes even it's better off in النهاية whoever wants the referral they can stay behind and refer the patient. Otherwise you go see the patient, know your patient in and out. من الحاجات اللي برضه بعملها في النهاية لما تيجي تتصل بأي department ثانية keep all your information in front of you. لو عندك ال observations شعر خطه بجنبك طيب البلادز حقتك خطها بجنبك قدامك ف you call you know your patient and you will guarantee 99.9% that the referral will be accepted. Otherwise زي محمد جبال قال هيقول لك امشي review your patient. I have done it. يبقى نشوف عارف البيشنت حقك لو عارف تسأل عليه ثاني. فليه to put yourself into such position يعني. So I think that's most of the referrals going to be referral either asking for investigation or referrals asking for other sort of specialty reviews. Regardless, it's going to be you know your patients, the indication of that referral. هذا sometimes في الورد يقول لك يا أخي والله محتاج لي medical review. ليه؟ You can ask في النهاية أنت ما شايف إنه والله في need. فask في النهاية ما في مشكلة ما في حاجة. Why are we asking for that? Maybe a consultant ولا رئيسة he has a different sort of way of thinking في النهاية. He is thinking a bit of more in advance. Something you are missing. Don't shy again. Why are we asking for? يقول لك يا أخي والله we are asking for example after the patient ده he most probably be heading for theaters and he has a pleural effusion. We have to sort that out. Okay, that's fine. You know the indication for the referral. It's just know your patient in and out. Be sensible. I think that's it for this.
Yeah, for that topic. طيب, we will move swiftly to the next point, which is the point that will concern you most. اللي هي not when you're part of the on-call team ولا بتعمل البوست quadrant, well, it's actually when you specifically are on call. And this is probably the most daunting point لأنك حتتخطى براك على المحك او حتتخطي براكي على المحك. At this point يعني you'll have to, there's two things I want to tell you about. النقطة الأولى اللي هي أنت you'll be dumped with lots of tasks من nurses about sick patients, about stable patients, about TTOs. You'll have to prioritize your job plan. خلاص عندك الليستة والله ده this is important, this is less important. ما كل ما تعملهم أو ما تعمليهم بالدور. جاني في الأول بعمل في الأول، جاني في الثاني بعمل لا. What you have to do is you prioritize your jobs. Who's sick? And this is called time management. أنا والله في الزمن الفلاني في 12 ساعة اللي أنا شغال فيها دي I will do this and this. الأهم شنو؟ Is this patient sick؟ يعني قال لك والله في patient septic قاعد في الورد، وفي patient هناك محتاج PTOs، وفي patient هناك عنده pain، وفي هناك زول تاني عنده IV fluids. You'll have to prioritize what's more important. والله يا أخي patient is sick وعنده temperature وعنده ده the sepsis to proven otherwise. He needs to be seen. المحتاج ل IV fluids انت you'll have to be thinking about what you should do. ممكن تكلم النيرس تقول لها يا أخي أبدي له Hartmann solution over 8 hours. I will come later and prescribe it. خلاص؟ يعني you can manage these two tasks at the same time. وانت you don't have to walk. بعدين العنابر دي يا زول بتكون في كل واحد في اخر الدنيا. عنبر الجراحه بيا، وعنبر الطبيب بيا، وعنبر الجايني بيا، وعنبر ممكن عادي تكون انت شغال في مستشفى you'll have to cover all of these wards. فعادي جدا انت what you have to do is you have to prioritize your jobs. التاسك اللي بتجيك دي تاخدها للسيك patients براهم والستيبل patients، وبعد ذاك الحاجات اللي كان بي left over لبكره ولا لليوم اللي بعده ولا ما حاجات مهمه. او اذا كان TTO ممكن تخلي البيشنت ده ما محتاج يشيل معاه ميديكيشن يمشي ويجي بعدين زول يجي يشيلها عليه. ف you'll have to prioritize your jobs يعني في on your own calls. الحاجه الثانيه اللي هي انك انت you have resources around you. You need to make sure that you make use of them. إذا sick patients you'll have to alert your seniors. إذا أنت F1 or F2 you need to alert the senior SHO اللي قاعد معك. You need to alert the registrar. In some hospitals زي ما أحمد مرات يشتغل في حتات the registrar is not on site. He's on call but not on site. إذا أنت محتاج لزول تاني to give you a hand please don't be shy. الزول ده الزولة دي who's supervising you should be around. They're paid to be around. You'll have to make use of them. The last thing when you get in trouble حيسألوك يعني الزول اللي كان supervising or الزول كان around or on call sooner عليك did you get them involved? The biggest mistake that you do is that you don't call them in or ask them for help. So this is another way of time management. Tasks are difficult which will take time. You go to them and you ask people to help you. Outreach nurses في حاجة اسمها outreach critical outreach اللي هم these especially nurses deal with sick patients. They usually have an intensive care background. They're very good. They're very good at assessing sick patients. You can always ask them to come and assess the patients with you. Just make sure you prioritize your jobs and at the same time make use of the resources. إذا في زول تاني بيقدر إذا في ناس تعمل bloods و cannulas make sure that they can أسألهم يعني إذا في كانيولا في آخر الدنيا لو سمحتي بتقدري تعمل الكانيولا دي لو بتقدري اعمليها لي لو عشان لحد ما أنا أجيك بكون عندي حاجات تانية I need to deal with. In your brain when your jobs list make sure that you prioritize your list and make sure that you make use of the people around you for your time management. أحمد لو عندك أي contribution that would be very valuable.
طيب بالنسبة لل on calls it depends where you work. أنا أحب بيها أنت شغال day on call, night on call ولا weekend on call. دي الطريقة اللي حاخدها أنا. ال day on call during the week أنت عندك كمية من الناس around you. Definitely as Muhammad said you have lost resources and even you can have other juniors which you can ask for help. During the night again it depends where you work. Most of the time some juniors المستشفى أنا شغال في الوقت الحالي F1 he gets the GP referrals. Fair enough, this is how overnight yes you'll have one or two GP referrals لكن it's the F1 job to see those patients to clock them and accordingly في النهاية to make an initial management plan. There is an SSO who can assist him in management plan. On top of that you are most of the time you are expected to cross cover surgical wards. It could be urology, it could be general surgical ward plus or minus some other specialties. المهم جدا زي محمد قال is prioritization. where you work انت ممكن تكون تمشي اول الشيفت اخذت الهاند اوفر بتاعك مر على العنابر. where النيرسز في النهايه والله انت you'll be around later if they can put all the jobs aside. طيب بالنسبه لك rather than they bleep you every single time لانه the more bleeps the more يعني ما في حاجه اسمها من البليب في السيستم للاسف يعني. فانت you establish your own way of how you run your own call. You can just go through each ward, ask them to prepare a list of the jobs that will be around, for example, midnight, الساعة 12. I'll be with you ward 21, for example. Put all your jobs aside, and I'll come and do it at that time. Find out who can put catheters, male catheters, because it's one of the issues. Who can put cannulas. Know, for example, الناس around you at that shift, طيب, and you can rely on them on doing certain jobs. بعض المستشفيات they have nurse practitioners so they can do those jobs. Fair enough. It will be very good, very beneficial. Sometimes no, you have to do all of these. Again برضه بالنسبة لك هذا لا يمنع ضربوا لك واحد patient septic versus patient who needs some IV fluids versus a patient who's wants some sleeping tablets. طيب هذه كلها بتحصل. فأنت بالنسبة لك كلها and I insist every call write it down. لأنه هتيجي لحظة don't rely on your brain on your memory. للأسف يعني في النهاية هتخزلك في النهاية. أنت it's a very busy job. It takes only one sick patient 2 hours. طيب بعد ما انتهي منه to sort him out or her حتنسي الجوبس الباقي شنو.
ايوه.
write everything down. بعد كده في النهاية prioritization في النهاية depends. انت بعد كده في النهاية into دكاترة. and I still في النهاية insist في النهاية you can make up. You are not just covering. You are not phlebotomists just putting cannulas or just taking bloods. No. Septic patient, it means okay, this is a patient. He's 3 days post-op. Now he's septic, quite what sort of things I'm thinking. Is it chest? Is it urine? Is it actually he has a complication from his operation? But you still forming your own. You approach the patient. You had a call in a ward or a care line, and the patient. By the time you are going there, you have already established with that patient that I get this way. That patient I have to get. I'll do my first bits and then I have to call my seniors for that patient. Well, is it just one of those patients who just a UTI? I can establish antibiotics. That sort of things. It's a very good learning opportunity along call. When I insist في النهاية إنه the best time you learn things is through along calls. حكاية الأون كول حقت الويكند mainly during the day. One of the issues منها ممكن we'll mention later or the discharge summaries. TTOs في النهاية whatever they call them between different places. It takes a hell amount of time the on-call team to sort out these sort of things that could be done during the week. دي حاجة إحنا you have to mention it later مش حاجة discharge summaries.
You can talk about it now.
Discharge summaries again depends where you work. Some places they're still doing it paper based discharge. Some of them they are computer based. It doesn't matter where it's at the end of the day it's a patient episode. Admission حقه دخل المستشفى ب either elective or emergency. دخل بكيس معينة have certain investigations, certain treatment, and they've been discharged either with some follow-up or with no follow-up. محتاج لبعض medications ولا without some medications to take home with. فبعض المستشفيات they insist إنه يكون مع البيشنت مش البيت لازم يكون عنده الديشارج سمرز حقته معه. وده الستاندرد هو يفترض يكون كذا لكن unfortunately it doesn't happen all the time. My point مع discharge summary is للأسف في الوقت الحالي I have to review all of my juniors TTOs unfortunately. You see lots of variations. Some people are very good, some people they are not very good. Let's put it this way. Discharge يتخيل روحك أنت في a different department ولا في clinic ولا في GP. What information would you like to know from the discharge summary? Someone has been inpatient. طيب. What sort of information? هل I'm interested يا أخوان this patient has presented with right upper abdominal pain for 3 days he is vomiting he is not. أنا ما interested في القصة دي كلها. معلش يعني هو في النهاية صحيح بالحياة دي كلها they have taken some history لكن في discharge summary it doesn't make sense. He came abdominal pain. Diagnosis of acute appendicitis was made. Patient had appendectomy between two brackets, laparoscopic or open, uneventful procedure. Went home the following day. That sort of depends. Most of the places we don't follow these patients up. Well, some places that being said follow up in clinic, quiz in that amount of time. That all 2 lines. That's it. Or he had a nasty appendicitis. بعدها had open appendectomy. had 4 or 5 days in the hospital, IV antibiotics, and the plan he will be seen in clinic in that amount of period of time. ف very important ما في داعي القصص الكثيره للاسف يعني في النهايه. الكوموربيديتيز investigations على CT scan confirmed the diagnosis. ما في داعي لانه بالنسبه للجي بي copy and paste من السي تي سكان ريبورت ما حتعني له حاجه. Unless, for example, CT scan has confirmed acute appendicitis, incidental finding of an adrenal mass, could you please refer this patient accordingly? ده الجي بي المفروض يعرف حاجه زي كده. لكن otherwise في الامبورتنت في البوزيتيفز في الامبورتنت نيجاتيفز دي مهمه. لكن copy and paste it will just add on information ما في اي داعي لها. الحاجه الاخيره بالنسبه للدشتايل سمريز من طرفي. يوم الجمعه you have done your ward round, you are anticipating some patients are going home over the weekend. All of you'll be doing some sort of an on-call at some stage. فأسوأ حاجة إنه تشتغل someone else's job. أنت في النهاية لو واحد عارف يا أخي إنه my patient will be going home Saturday Sunday, do the discharge summary. You leave to the on-call team. حيحصل إنه حتيجي on-call أنت وحيخلوا لك الشغل. فهذا بدك كوسر كده يعني في النهاية. كوسر في النهاية إنه واحد will dump الشغل طيب لناس تانيين. And over the weekend you have enough work. ما عايز أي sort of additional work.
بالضبط أيوه.
This is my point. I think محمد.
Your on calls أنت تذكر إنك you'll be overstressed and يعني لدرجة حتكره نفسك. You'll be يعني a lot of pressure. 12 ساعة دي يعني حتكون تحت ضغط شديد من جميع الأماكن. كل واحد متغيرك تكون أنت الزول القاعد قصاده أو أنت الزول القاعد قصاده. Which is completely incorrect. The easier your on call is by people helping you by doing the discharge summaries. وانت ذاتك لما تكون او انت ذاتك لما تكوني during your elective day, just remember that people who are doing on calls should actually not be doing your TTOs for you. بالذات الويكند. They should be knowing their weekend plan. فلما تاخد انت او تاخدي انت precise weekend plan that's to the point او بيشرح in a few bullet points what the patient's problem is and what their management plan. الأون كول team اللي هو غالبا يكون برضو انت او انت في in another couple of weeks, you'll find انه this will make your life easier throughout the ward round وحتى لما تيجي to review a patient or even on night. An easy documentation is an easy assessment. This is about documentation. Your TTOs, despite them not being one of your priorities on your on call, you'll be the person that people will go to when it comes down to it. Expectations as a junior doctor in TTOs will be part of your job. يعني you can either pile them and تقعدوا في lunch break بتاعكم تاخدوا الأكل بتاعكم or you type while you're eating, whatever way you want to do it, or you leave it for the يعني but just remember في النهاية إنه your jobs list you'll have to be prioritized. الجزء منه حيكون السيك patients والجزء الثاني حيكون جزء منهم discharge summaries. You have to also get to them يعني. The more you do, the easier your life will be. بس تذكر يعني your shift ends when the hour comes. فخلاص الساعة 8 أو الساعة 10 جات والشيفت بتاعك انتهى, you'll have to hand over. Handover has become part of our daily job. You can't do a task, you'll have to hand it over. لكن at the same time don't dump them. يعني ما تخلي الحاجات كلها to pile وبعد ذلك تمشي تدري. Well, handover is also part of an important part of your surgical on-calls. If you can't get a job done or you've seen a sick patient, you'll have to highlight it at handover time. تكلم الناس اللي قدامك إذا you need to be highlighted, the registrars need to be informed. تكلمهم at the time of handover, I've seen this sick patient, or I know about this sick patient that I've not seen, that will need a senior review. أو في jobs that I have not managed to complete, do you mind الأفون اللي جاي بعديك to pick these jobs up.
I think it will be a shame إنه نتكلم على surviving your first surgical on call without mentioning you'll be called to theatres to assist at some stage.
Yeah, that's a possibility. Yeah.
It will happen sometime, and even if it doesn't happen, you have to ask. Okay, most of the time you can think, okay, there's an F1 and people will crack on in theatres. It will be very nice actually for you to get involved in theatres, and it's a surgical job, and this could be your only ever surgical placement in your whole career. It depends, you want to do GP in the future, medicine, whatever specialty. it will be nice that you get involved yourself in theatres at some stage.
But at the same time, don't be in a hurry to go to theatres because that's the surgically oriented. Make sure that you at some point you will get to theatres. Like, make sure that your priority is the wards and your jobs. إذا في زمن بعد ذاك you can go to theatres إذا فاضي.
At night sometimes you might be called to assist.
Yeah.
In that event, you have to make sure that you let the nurses or whoever that you are you'll be away for next 1 or 2 hours. And let them, because what will happen is you'll be in theatres, they'll keep bleeping, and for them they'll be documenting doctors bleeped, no answer. You don't want to be put yourself into that position and then you start to justify yourself at every single time. That's one. The other thing is part of the on-call is once your shift has finished, you make sure something is going to be a balance between documentation and the list. You have to update your list. And that's part of that job. All the admissions during the day, it could be either, depends where you work, it could be either the SSO who is admitting patients or it could be the F1, but either way you have to make sure that all of the admissions, their names are on the list, and what's the provisional diagnosis, if it's or confirmed diagnosis, what investigation has been done and what investigations are to be requested. And then that has, and the list is part of our handover. Mohammed has just mentioned the handover. You should have a proper list. I mean, the list, there are 2 lists. There is the list which is your normal, regular inpatients, and there is the on-call list, which is very important as well. You have to keep it up to date, because the worst thing is you hand over the patients with the incomplete list. You'll just يعني عامل الناس مع بحب الناس يعملوه the same way.
عندك نقطة ثانية ولا أنا؟
No, I think it's problem.
So my last point اللي أنا حتكلم فيها زي ما we want you to look after your patients, we also want to look after yourself. You'll have to make sure that you take your breaks. خلاص يعني it's very easy under the pressure and the strain of your job انك انتوا تنسوا انه انتوا you are human beings. يعني عندكم حوجات زي ما الواحد المفروض ياخذ راحته. المفروض اللي داير يصلي يمشي يصلي ولا اللي يمشي ياكل. لما يقدر يمشي الحمام. You need to make sure انك انت as a human being you need to get your needs as well. Make sure that you rehydrate yourself, you refuel, and you're ready for the next task. The worst thing that you can do is do something when you're tired. It's when you're tired is when you commit mistakes. But don't stress yourself too much. ما تقعدي بعد الشفت ما انتهى تقعد to complete the jobs. والله أنا ما بقدر أمشي. It's a good thing to have a good task management. What you can't do, you'll have to move on. لأنك أنت غالبا إذا كنت on call الليلة احتمال كبير تكون on call بكرة. خلاص. The later you leave today, the more strain you'll have on tomorrow. You'll hand over what you have to hand over. So make sure that you refuel, you rehydrate, take your breaks. لأنه ما في زول حيجيك وحيقول لك يا أخي لو سمحت عليك الله مش يأخذ البريك بتاعك. This is your job, this is your task, this is what you have to do. So you have to look after yourself. Within that busy day job, within that busy on call, you'll have to squeeze some time where you can look after yourself and you take your breaks. This is probably my last point, and this is actually always يعني I've been trying over the last few years إنه يعني أسأل الجونيors have you taken your break لأنه يعني you have to be nicer to people, you have to make sure إنه because we forget as human beings, we forget إنه والله يا أخي في حاجات إحنا مفروض نعملها ما قاعد نعملها مع البريشر بتاع الانقول. One of them is the breaks. So just make sure you do that. The more energy you come back with, the better you perform.
I'll just add to Mohammed's point. You have to look after yourself. ما في أي زول, unfortunately, the culture at the moment ما في زول حيقول لك يا أخي والله خذ your own break. The question normally I tend to ask the juniors: do you have a dying patient? The only patient who's very sick, yes, go and see them. لكن just for the normal sort of jobs, you can prioritize. Take your breaks. If you have you're on a 12-hour shift, you haven't had anything to eat or drink, and you have the physiological needs. يعني. Unfortunately, what will happen is your level of concentration, decision making, it will all be compromised. It will affect you first, okay, before even anyone else. Look after yourself. A 5 minutes break, it makes a massive difference. It's make a massive difference. The other thing is some people, it looks sometimes fine, like sometimes it might backfire, which is staying behind, try to sort out the jobs that hasn't been done during the day. لأنه it will happen that consultants will say, oh, he hasn't managed his time during the day. So that's why he's staying behind. But despite it might look okay, he's very hardworking, she's very hardworking, they're staying behind. Like if you're staying behind to finish your day jobs, which has been there for a long time, it will actually backfire on you. It's like, okay, he's actually lacking the task management, time management.
It will reflect badly. والحاجة الثانية legally you're not covered to stay beyond what your shift hours are. If you commit a mistake, إذا كان الشيفت بتاعك بادي الساعة 8 وبيخلص الساعة 8 المساء, if you make a big mistake بعد الساعة 8 أو 8 ونص, whatever the shift بينتهي, if you commit a mistake at that time, people will very difficult to defend it for you. You'll have serious explanations. عملت مشكلة وحصل البيشنت's consequences, it's not defendable. الحاجة الثانية about the breaks, the only thing that should stop you from taking your break is a crash call, اللي هو medical emergency. It's the only time where you have to drop everything وتمشي على الحاجة, سواء بتاكل ولا بترتاح ولا حتى بيشوف في patient ثاني. The cardiac arrest bleep goes off وانت قريب من الحتة أو انت part of the cardiac arrest team, you should leave whatever you're doing and move to. دي الحاجة الوحيدة اللي بتخليك انت ما تاخذ البريك بتاعك أو تبطل الحاجة اللي انت بتسوي فيها. Otherwise I think يعني you should be able to take your breaks. شايف أمجد بيسألنا يعني what about minor surgery and other procedures? Is there room for these and consents? I'll talk about consents first. You should only consent for procedures that you are able to perform. إذا أنت you don't know cholecystectomies ما تمشي to consent the patients about cholecystectomies. إذا أنت ما بتخط drains in patients done under intervention radiology, please do not go and consent patients for that. If you are happy to consent, if you're happy to operate on these patients, then that's the only time that you can consent them for. وبيسأل about minor surgery and other procedures. إذا بتسأل whether you can actually attend these procedures, I'm sure يعني people around you will be happy to accommodate that. أما إذا كان سؤالك إنه يعني is there your responsibility ولا لا, they have to be part of your responsibility. إنك أنت يعني to update their TTOs, whether to update them on the list إذا أخذوا, إذا كان عندهم minor procedures day case list, they'll be part of your teamwork. So you have to update the list. ما أعرف هل في
I think that's point in session ده كله is part of it's a generic sort of surviving any sort of on call job, okay, mainly for a surgical job, and what from a perspective متوقع شنو منه. It will differ, for example, where you work. There will always be some sort of different variation between different trusts and different hospitals. What sort of cross-covering specialties? I've worked somewhere that I was cross-covering urology, general surgical, surgery, urology, gynae, ENT. It happens you cross-cover. It depends where you work. Their expectations, each department is slightly vary between, but these are the main points that you have to. You are a doctor, alright? So okay, the expectations are going to be the same. Doesn't matter if you are seeing a patient with an epistaxis or someone with the hematuria or someone with the PR bleed. It's going to be all the same.
والجراحة طبعا is a very straightforward specialty. حاجاتنا واضحة كلها يعني ما فيها تعقيدات. Patients are they can be complex on their operative point of view. Like in what they had is pretty straightforward. يعني people are around to support you. يعني we're usually on site. There's usually somebody to contact. Always make sure that you make use of them.
And one last point to add. If he or she either, regardless, you would like to pursue a career in surgery in general, as an F1 or even a junior SHO, I would advise approach your registrar very early during your placement. It's not about, but you'll be looked after in a different way. يعني مش لكن at least if there is any sort of a minor sort of procedures, I'll be happy to have someone with me who wants to do surgery. A general sort of stuff that will be done on a regular basis. It doesn't matter between who wants to do what. Like if someone is interested in doing surgery, I approach us early, or your registrar or whoever, at very early stage during placement. But it will make a massive difference in your long term.
So as Ahmed highlighted, يعني if you're keen and interested, people will يعني ما أقدر أقول لكم look after you, لكن يعني the people know who they're after يعني they spot these things quite early. فإذا أنت شوت interest, they might take you under their wing زي ما عملنا اللي كم زول يعني. They might take them under their wing or take you to theater يعني spare you some time. where they talk to you about things in detail and then help you with career advice. زي ما قلت في النهاية يعني make sure that you make use of the resources around you. إذا في people to help you, إذا في حاجات ممكن زول يعمل لك، إذا في and know the hospital that you're working in and out من أول أيام أنت قاعد فيها. تعرف ال IT system بتاعهم، تعرف المداخل بتاعتهم، تعرف ال resources اللي available، تعرف الحاجات اللي بيعملوها، الحاجات اللي ما بيعملوها. different trusts operate differently. يعني it will be very difficult for you انك يعني في فيديو واحد تعرف ال NHS ده كله قايم كيف وشغال كيف وكل مستشفى قايم كيف. لكن ال outline we can give you. ال details you'll have to find out in your own hospital. Just make sure انك انت قبل ما تبدا الشغل، بالذات قبل ما تبدا الون كول، you are very comfortable about how the system works in the hospital. أكعب حاجة تجي لون كول تقول والله يا أخي أنا ما عندي باسورد، أنا والله ما عندي أكسس، أنا والله ما بعرف أعمل كده. It will reflect very bad on you. But once your reflection has been بالضبط. Once the impression about you is projected as negatively, it'll be very difficult. بالذات as a foreign graduated doctor, it'll be very difficult for it to come from back من الحتة دي يعني. I think we've highlighted all these points, and in summary يعني be precise, be concise, know the hospital, know your system. Documentation is very valuable. Make sure that you use the resources. يعني in summary, these are the points that we talked about. We'll happily take any questions and answer them. We'll give you about 5 minutes waiting for the questions. إذا ما في حاجة, we will probably just end this session and close it. على 5 دقائق كثير.
I think all the questions can go into the comments section, and then hopefully
we can answer them. خلاص دي احتمال تكون حاجة ثانية. Okay, what we'll do, we will according to Ahmed's plan, we'll end this session. And then we will take on all your questions and to answer them at our own leisure. And hopefully we can also message us if you want, and we can answer you in details. في نهاية الإيفنت دي أنا بحب أشكر الأخ أحمد بابكر على his valuable contributions today. يعني we have not been able to complete this without his presence. وبشكركم أنا محمد عبد الرحمن خليل. وأقول لكم السلام عليكم.